Okay, good afternoon. Welcome to the Thurston County Board of Health meeting for this Tuesday, March 14th, 2023. It's 4:30 p.m. My name is Ty Mentor, Chair of the Board. To my right is our Vice Chair, Board Member Maria Williams, Board Members Beth Harvey, Lynn Nelson. To my left is Board Member and Commissioner Carolina Mejia, Council Member Robin Vasquez from Lacey. Commissioner Edwards may be joining us by Zoom. We expect that. And then Clerk of our Board of Health, Jamie Caldwell. Calling the meeting to order, we'd like to approve the proposed agenda. Is there a motion?
I would move to approve the agenda.
Second.
Been moved and seconded to approve today's agenda. Any discussion? Hearing none, call for the vote. All in favor, say aye.
Aye.
Any opposed? Thank you. I'd like to thank Vice Chair Williams for leading last month's meeting. I was working on a health issue at a wastewater conference, so that was super interesting, and I appreciate, I got to watch on the YouTube, so caught up with you guys. Next is the opportunity for the public to address the Board of Health. We have 4 minutes per, and we have general speaking guidelines I'll go through quickly. When called, introduce yourself, including area of the county in which you reside. Address the board, not audience or staff. Silence your cell phones. You're limited to 4 minutes and cannot donate any time to another speaker. No comments that are lewd or offensive, inflammatory, hateful, or discriminatory. Be respectful. No outbursts of any kind or comments that are commercial in nature, such as promoting a for-profit business. Any written materials that you have can be submitted but will be subject to public release upon request pursuant to the Public Records Act. Provide those to the clerk of the board. No remarks about pending land use permits or similar matters that could come before the Board of County Commissioners on appeal or any Board of Health members. And with that, I have Jenica Machado signed up.
Hello, Jennifer Machado. I work here at the county as Economic Development Manager. I'd like to provide a comment regarding an item on your agenda later around the proposed policy.
Second.
There's something on. Around the proposed policy allowing routine year-round food vending from booth setups. Both are a partner at the Thurston Economic Development Council, and I support the approval of the proposed policy. The new policy provides business owners and entrepreneurs a pathway to starting and operating a business with reduced barriers. This policy helps support local economic development. Thank you.
Okay, that's related to item 5A. I don't have anyone else signed up. Is there someone in the boardroom that wanted to give public comment that didn't have a chance to sign up? No? And then on Zoom? No, okay. Well, then we'll move along. Item 3 is we're pleased to have a proclamation for this meeting. International Transgender Visibility Day is on March 31st, and we are going to read a proclamation related to that. And in honor of that, we have some guests I know who are from PFLAG. And if you guys could come forward and you'd have the floor for any comments you want to make. Yeah, right up to the mic. Regarding the significance of this proclamation from your perspective. Thank you. Welcome.
Yeah, thank you for issuing this proclamation.
Can you introduce yourself?
My name is Larry Cronquist, and I'm the treasurer for the local chapter of PFLAG. It's actually the 50th anniversary of PFLAG National. PFLAG is the second oldest continuously operating gay rights organization in the United States, second only to Lambda Legal. And our mission is to keep families together. It's always been a parent support group primarily, but we just do any and all things that are related to keeping the LGBT community protected and families together. And this is Luke Miller, who's also on the board of directors.
Members of the board, thank you very much for issuing this proclamation. I would like to say that as a member of the transgender community, we appreciate it whenever our allies, individuals, government entities, or organizations step up to help us be visible and be understood with state legislatures all over the country introducing legislation aimed at erasing our very existence. It is more important than ever that we be visible, that we be out loud and proud, and every motion, every move like this by a government entity such as yourselves is always helpful to that end. So I'd like to say thank you very much to the board and to Thurston County for welcoming us and recognizing us as citizens and members of the community. Thank you.
Thank you for being here. Appreciate it. Any comments from board members before we go to the proclamation?
Thank you for being here.
Board member Vasquez.
I just wanted to say I'm also really glad that we're doing this because there's a great deal of hardship being faced by the trans community right now, and that includes in healthcare settings. A report just came out today that cites some harrowing statistics, including that 1 in 5 members of the trans community were flat out refused care. And this is a nationwide survey, a very large healthcare survey. And that 28% of the transgender community responding to the survey experienced harassment when they went to seek healthcare. So this is a really pertinent issue for the Board of Health to address.
I just also wanted to thank both of you for coming today and congratulate you on the 50th anniversary of PFLAG. That's really exciting. And I also agree with Councilmember Vasquez on the importance of this. We're seeing suicide rates go up for our trans community as they're facing a lot of bullying in our very own communities even. And so just having this acknowledgement with everything that's going around in the country that goes against this and goes against you as a human, as a person, is just a way that we want to acknowledge that you are welcome in our community and that as a Board of Health, we find this issue very important. So just thank you for coming here today.
Okay, we're going to start Thurston County Proclamation, International Transgender Visibility Day.
Whereas International Transgender Visibility Day was founded in 2009 to acknowledge and honor the successes achieved by transgender people, such as US-based transgender activist Rachel Crandall, a licensed psychotherapist and the executive director of Transgender Michigan.
And whereas organizations across the world celebrate International Transgender Visibility Day as an annual day to celebrate the accomplishments and victories of transgender and gender nonconforming people while raising awareness of the work still needed to save transgender lives.
And whereas International Transgender Visibility Day is intended to recognize and celebrate the work being done by transgender advocacy groups as they fight for dignity and equal rights for our members of our transgender community, to build inclusive and healing spaces, and to protect and defend those who are most vulnerable.
And whereas Thurston County recognizes the significant contributions made by transgender people and affirms they are vital members of our community.
Now, therefore, be it resolved, the Board of Thurston County Commissioners hereby proclaims March 31st as International Transgender Visibility Day in Thurston County and urge residents to honor the lives of those lost through participation in community service and remembrance ceremonies.
Adopted this 14th day of March 2023 by the Board of Health. Thank you. Photo?
Would you be open to a picture? Would you be open for a picture?
Sure.
You're welcome, right? Yes. All right. We gotta do like the sideways stand.
The sideways thing, yeah, it's more fun.
Sorry.
All right,
I'm wide.
1, 2, 3, go. All right,
Okay, now look at her, and then you're gonna look at me.
awesome.
Okay, last one.
Thanks, guys.
Thank you.
Probably got one good one, right?
My transgender nephew.
Oh, thank you. You're very welcome.
Thanks a lot.
Yeah. Okay. Fantastic.
Okay, item 4 on today's agenda is a presentation that we are all looking forward to, opioid fentanyl epidemic update. Looking forward to it because we have some important guests to give us some background information. Our coroner's here, Gary Warnock, our prosecuting attorney, John Thunheim. We have representatives from the Sheriff's Office, Dave Pearsall, our undersheriff. And I don't know what order you guys want to present. I know that we've got slides for, I want to say all three of you. If you guys talked about who wants to go first?
Who's first?
The sheriff's office.
Sheriff's Office first? Okay, then that sounds good.
Good afternoon. Thank you for having me. I'm Lieutenant Rudloff. I'm with the Thurston County Sheriff's Office. I'm currently the commander of the Thurston County Narcotics Task Force, which the Sheriff's Department is the parent agency of. Do have just a few stats for you today and a few slides. First slide up here is just our Narcotics Task Force makeup. As you can see, we are made up by the Sheriff's Office, which is the parent agency. We have a Homeland Security investigator. We have 2 Department of Corrections, Community Corrections specialists within the department. And we have a detective from the Washington State Patrol. We have both a civil and a criminal prosecutor. We have a legal assistant that works for us as well. And then the next slide is just the breakdown of the members. Don't think I really need to get into that, but basically we have a short crowd. In terms of other task force, I'm a lot less staffed than other task force. One of the problems is about 10 years ago, all 3 cities, Lacey, Tumwater, and Olympia, pulled out of the task force and have yet to come back. We continue to work with them to do so, but obviously every time you take a detective away that's focused on the opiate enforcement, then that it affects us. So the next seizure, or the next slide is just the seizures we had in 2022, just related to opiates. I put both grams and pounds there. Grams, I have to report to HIDA, which is the majority of my funding for the task force, but the layperson usually understands pounds. So heroin, 2.93 pounds, and just over 5 pounds of fentanyl in 2022, whether it be pill form or powder form. Either way. And then the next slide is the 4-year trend. This slide's just a little bit of a misnomer, and I have to explain it a little bit. You would think that we have a up and down trend as far as opiate is concerned, and it's really not. The trend for that we see as far as for enforcement is consistently continuing upwards. This represents seizures, so obviously my unit can only do the amount of operations that A, I have the money for, and B, that I have the ability to investigate. So let me give you an example in terms of the year in 2020 when we had a downward year. That happened to be the year that I didn't get my Burn JAG grant, federal grant. That was a lot less money, like over $400,000 that I was missing. You can't buy, there's not as much money for criminal operations. And then I specifically, 2021 was a really high year because I focused the task force to almost exclusively go after opiates, in particular in fentanyl, because we just seen that explosion. And I was trying to get as much of that off the street as I could in Thurston County to try to help some of them overdose and deaths. And then back to 2022, we're on a downtrend. And what I can say as far as what affects that is this is now 2020 2022 was the first full year in which they took simple possession drug laws off the books. So what does that mean to me, or how does that translate to the task force? Well, the majority of our confidential informants, the people that come and work for us to get upper level dealers and mid-level dealers, the people that are pushing this death drug, are not as motivated, come to find out, if they have no motivation to come and work for us. So I have our confidential pool of informants just plummeted. And now the ones that do work for us, I have to pay them a lot more money. So again, less cases. So if we flick to the next slide, this just goes to show that cases work. There has been no downtrend at the Drug Task Force for us working opiate cases. Ever since 2019, we've at least been at 60% of cases worked are opiate related compared to all other drugs combined. And as you can see, last year when I did emphasize in opiates and in particular in fentanyl, our cases were even more than all other cases. So we continue to understand at the task force that the trend for the street level drug is consistent and continues to go up. In fact, just as a couple examples, I have a recorded conversation from a drug dealer just last week talking about how he can't hardly even give heroin away. That is how popular fentanyl has become. Nobody wants the heroin. The cartel is still pushing the heroin on them because they still have the supply. So essentially, if he wants to get his dope from the cartel, which they all do, that's where it all comes from, then he has to take what they give him. So they will not only give him the fentanyl, they'll say, well, you got to take this 10 pounds of heroin too and get rid of that as well. And he was on a whole recorded conversation how he can't get rid of it. So just gives you an example. From our perspective, definitely fentanyl is number one on the street. It's the number one addicted drug out there, and it's what's causing us the problem. Looking forward, and what are we doing? Well, as the sheriff's office, and obviously we're leading the fight with being the parent agency of the task force. We have adopted an overdose death investigation checklist to improve the potential to pursue illegal drug homicide cases related to the opiate crisis. So there is at least some accountability to the people who want to deal this death drug. If we can make a case on them and charge them, then we definitely will. And we've come up with that checklist to help that, and we're spreading that throughout the county with all the law enforcement agencies. The Sheriff's Office also promotes partnerships with local, state, and federal law enforcement agencies in the pursuit of bringing additional law enforcement officers and staffing to TNT. We feel that this is vastly important because right now the Narcotics Task Force is the only dedicated enforcement body in the county fighting this problem. So, all our patrol divisions, all our other investigative divisions within all the police departments and the sheriff's departments out there, they're not chasing drugs. They don't have the time. They're going call to call to other types of calls, and the task force is the only entity fighting this problem. So, and you do obviously have to have an air of the enforcement portion of this as well for it to work. We're also continuing to pursue the police departments and ask them to come back and fight and share in this burden. We've had some good talks, and we actually, with Olympia Police Department, we have had some personnel sharing with them where they've come down and worked with a few days a week. So we're trying to move that on to being back to full time. So we still work with that. We continue, as a sheriff's department, we continue to support government, public, and private-based entities which provide opiate addiction treatment and recovery services. Certainly, we understand as the sheriff's office that though our portion of this fight is the enforcement action, it's only one part of that fight. We understand that provider-based services play a vital role in this opiate epidemic. And in terms of what we feel as the sheriff's office, we would always want the outcome that we get our addicted community to be not addicted anymore and to get back on track and living a good life. So, the enforcement part of it is only in pursuit of making sure that we get them people back on the right track. And then finally, we actively participate in any known public or private forums that will welcome members of the Sheriff's Office in an effort to spread awareness and education of the opiate epidemic. We acknowledge the public health danger of opiates, and in particular of fentanyl, which is that single particular drug has been increasing in popularity with opiate addicts over the last several years. It has driven unintentional drug overdose rates up dramatically within Thurston County, and I'm sure Gary will share the numbers with us on that, which will be an unfortunate shock of events, because that is increasing as well. That is my presentation. If you guys have any questions, I'm welcome to answer any, and I thank you for listening to me and being part of the solution, hopefully.
Yeah, let's go chunk by chunk with questions. There are questions for, Sheriff. Board member.
Thank you so much for this presentation. I'm wondering, is there, 10 years that the cities have pulled out is a long time, and thank you for really everything you do and trying to keep our community safe. But I'm wondering, is there, as we look towards the future, is there any hope that the cities will come back and revamping this task force?
I'm encouraged that at least 2 of them will come back. Again, the one Olympia Police Department has an individual coming to us a couple days a week with the hope that that's going to turn into full-time. The Lacey Police Department had some upper level talks with them, and they talk about staffing issues, and as soon as they can get their staff, they had just annexed some of the county, and so their numbers are down a little bit, and they wanted to be up a little healthier numbers as far as their staffing to man that part that they took from us. And we talked about maybe fall, making something happen fall this year. The other Tumwater Police Department, unfortunately, I don't see it happening until there's a change in the role of police chief. He's told me directly to my face that he doesn't get it, doesn't know why we would need, he'd need to waste a resource for somebody to be at the task force. So it's just what it is.
Other questions on law enforcement side? Nope. Okay, thank you.
Thank you.
Good afternoon. Dave Pearsall with the Sheriff's Office Under Sheriff. Just real quickly, I want to let you know what you'll see a press release probably coming out in the next few minutes that we have. But it's just to show that it's not just out on the streets that we're dealing with this. We had, since March 5th, we've had 6 overdoses in our jail. And of those, we were able, with our Narcan, corrections officers were able to save 4 of those people. One was several days ago, and yesterday he died at St. Peter's Hospital from the overdose. Last night, we had 2 subjects that were found in their jails while the corrections officers were doing their checks. They found 2 people in one cell that were unresponsive, and they pulled them out, and they were able to give Narcan, 4 doses of Narcan to one of them, and that brought him back. They gave 6 doses to the other and performed CPR, and they were not able to get him back. They had the medics come in. Medics got a very slight pulse, took him to St. Pete's, and he's there on life support at this point. So it's not just out on the streets. We're starting to see it get into our jails, and we've got scanners. We can't do strip searches on everybody. By law, we're not allowed to. So it's just, we're trying to do what we can to prevent it and keep it out of there, but it's definitely affecting us, so.
Thank you.
Thanks.
Coroner next? All right. Oh, sorry, do you have a question?
I know that administering multiple doses of Narcan is not harmful, right? You can give someone 2 doses, but I've heard it as being 1 to 2 doses. So is giving someone 4 or 6 doses an indication of the level of fentanyl or opiates in the system? Like, it was a lot, it sounds like, in order to get a response, because I've always been trained that you provide 1 to 2 doses.
Right, I've always heard 1 to 2 doses as well, but having been out last night with this, and talking to people, they're saying they're routinely having to give 3, 4 doses sometimes and they're able to get them back sometimes when they give that much, but,
Yeah.
you know, I don't know about the potency, how much, you know, I can't speak to that because I don't know, but
Right.
we are using more than 1 or 2.
Dr. Abdemalik is shaking her head. She wants to.
You're hiding back there, Dr. Abdul. Do you have something to add?
No, I was just agreeing with the classic teaching has been 1 to 2 doses, and yes, with fentanyl, we are seeing a need for increased doses, just with how potent fentanyl is.
Okay, let's go to a corner.
I don't have a copy of my slides.
Here you go.
That's okay.
Here.
Oh,
I have to.
all right, thank you. Thank you, Gary Warnock, Thurston County Coroner here. It's a sad state of affairs in the community we live in. Overdoses is there a slide there somewhere? Anyway, so synthetic opioid is 50 to 100 times more powerful than morphine. It's present in numerous drugs, meth, cocaine, ecstasy, and counterfeit pills. It's cheap and it's extremely more addictive. Many users don't know they're purchasing fentanyl, and which results in suicide deaths. The manufacturing, how the drugs make their way to the United States. The chemicals come from China, and they are made in crude, and when I say crude, very crude laboratories in Mexico. It's not a lab, it's a cow pasture. It is stirred up, and the people mixing it are upwind, so they don't breathe the fumes, because if they breathe it, it's going to kill them. And this is all over Mexico, and then it gets into the United States through Canada and the Mexican border. And it's coming in powder form, or it's pressed in Mexico to make it look like a Xanax or a Percocet, you name it. It's in every drug. Pictures of counterfeit and real and fake pills, oxycodone, Adderall. And there's the Xanax. And someone who's not familiar with medications or the pills, you would think by getting one of these that you have the real thing. As a coroner or investigator with the office for 17 years, if you were to hand me a counterfeit pill, I wouldn't be able to tell you if it's fake or real. I just don't. I don't know what they're supposed to look like. So to have it compared, people don't carry this in their back pocket to compare whether or not it's fake or real. Common drugs of abuse. This is what you're going to find on the street in some of our death investigations. They've color-coded it to make it look like a candy, so it's more appealing to the younger generation. It is administered through, they can smoke it, inject it, or just ingest the pill itself. Lethal dose of fentanyl is what you see right there. It's just a couple granules of like sand that will kill somebody. So when they're mixing this up, again, these are crude labs. There's no quality assurance as far as what's in there. So if you take a pill and quarter it out, it's a game of Russian roulette. You take that quarter pill, you may not get anything. That quarter pill is probably loaded with fentanyl, and it's an overdose death. The next one is just shows the increase of overdose deaths from 2019 to current. In 2019, we had 47 confirmed overdose deaths. 10 of those involved fentanyl. In 2020, we had 57 confirmed overdose deaths. 17 were fentanyl related, or a combination of multiple drugs, but fentanyl was the common denominator. In 2021, we had 102 confirmed overdoses and 51 fentanyl-related deaths. And then if you look at 2022, where we had the big spike, 147 confirmed overdose deaths, which is, that's inaccurate because I just did the updated number and we have 153 for 2022. And 114 fentanyl-related deaths that went from 51 to 114 in a year's time. And then, so total 147. Again, that's a fluid number because it's going to fluctuate because we have pending cases. 109 were males, age range from 18 to 77. Females, there were 37, age range 0 because we had 2 infants that died of an overdose, and the oldest was 72. And gender neutral was 1 at age 24. And then 1 pill can kill. Yeah, these are sad numbers. I didn't want to be here. I think I needed to be here to share this story. Oh, thank you. Is everyone, you guys got this? Okay. So this is a snapshot of our case management log for 2022. And if you, I didn't have a time to separate everything, but if you look at the autopsy immediate cause, you'll see the common denominator there is that 90% of these deaths resulted in fentanyl. And we have, I think it's 1, 2, 3, 4, maybe 20 pending still that we're still going to update that number. So I will like to say that this has created a lot of resources for my office. It's time, it's, you know, it just boils down to expenses. Every case that we bring in for the overdose deaths is that person's the candidate for an autopsy, and then there's lab costs. And so it's just the influx of caseload and resources that are being spent. But 147 of these deaths are 100% preventable.
Questions for Coroner? Warnock? Board Member Vasquez?
On the report you provided that has the detail, where we see drug death, mixed drug toxicity, does that mean there's an interaction happening with multiple drugs in the system?
Are you, this one here?
Yes.
Ask that again, please.
Does the circumstances type drug death, mixed drug toxicity mean that there's multiple drugs in the system interacting?
Yes, yep. So when we do our death investigation, we can tell them, the toxicology lab, that there's drug paraphernalia. And when we bring the decedent back, we do a urinalysis, and it'll tell us what's in their system at the time of death. And then so we know what to test for when we send that off. And then they send it back with the levels of the drug that was in their system. So it's a cocktail of drugs usually. Heroin, fentanyl, cocaine, heroin, THC, which is pot, and fentanyl now. Yeah.
Thank you, Coroner, for this very sombering presentation. My question is in regards to the numbers for 2023. Does it look like we're going to be either at this level, or are we just going to keep going
We're
up?
going to keep climbing. There's, as the sheriff's office said, fentanyl is it's not going anywhere anytime soon because they're finding new ways to get it across the border, how to deliver it. And then there's a new drug that's coming in. It's xylazine, which is a horse tranquilizer, which is laced with fentanyl. I know we're seeing it coming from the north and the south, and I'm not certain, but I think we may have picked up our first case, maybe today. It's not confirmed yet, but it's coming. I've been in touch with our health department because they're curious if we've seen it in Thurston County yet, and the answer was no, but it's coming. And it's only going to get worse.
Go ahead.
So why do you think, and I don't know if this is a question for you or for the sheriff's department, but what is the reason that fentanyl is being sort of mimicked to appear like other drugs? Why do they imprint it to make it look like a Xanax or look like something else? Is it to go under the radar for prosecution purposes so that when it comes into the country, it looks like a legitimate prescription drug? Or is it something else?
Well, primarily, we will see it in the blue pills. And again, yes, that was in the initial, and we're talking many years ago now, the initial ploy was to pass it off as the oxycodone. Remember, we had the oxycodone thing going on, and then we had the fake blue pills. So that just continued. As far as the changing of the colors, and now we're seeing people don't even want, I mean, the latest, greatest thing is they don't even want the pills. They want the straight powder, so they can take the powder, the pure fentanyl powder, and mix it as they will to their own. It's just an advancement in that sad addiction of the individual user, and I think I told somebody today, it was a dumb analogy, but if everybody in this country wanted to drive a Yugo, we'd probably be just bringing Yugos in right and left, right? It's the demand. That is the demand. That's the addiction. That's the powerful addiction that we're in of opiate in general, and specifically fentanyl. Is there a lot of unknowns in that? Like he said, now you can see it in any drug you get. You can see it in cocaine. You can see it in methamphetamine. You can see it in marijuana. And so more and more of our community members are, maybe are people that would use a particular type of drug, but they're not necessarily what we would look at and say an addict. They're being tricked, and they're being fooled, and they're being, unfortunately at times, either overdosed or even have been killed. So there is some of that, but make no mistake, the actual addiction, the opiate crisis addiction we have in this country is what is feeding fentanyl. The cartel is not going to stop. That's the product that's selling. That's the product they're going to get across the border and get to their customers. Does that make sense?
Yeah, it's troubling to me that there's a likelihood that someone can get poisoned, like without ever knowing.
Oh, definitely. A majority of the people that are overdosing are unaware that they're taking fentanyl. They're being told it's methamphetamine or it's just heroin.
Oxycodone. Yeah.
Yeah.
Thank you.
Thank you, Mayor Warnock.
Thank you.
We've got one more piece of this, and I do see that Commissioner Edwards is on and Sheriff Sanders is on, and I'll give them a chance at the end, but let's go to our prosecutor, John Tunheim.
Hello, my name's John Tunheim. I'm the county prosecutor. I didn't come here today with any particular prepared remarks. I actually came here because I was interested in the same information that you've been hearing and to get current on what's going on in law enforcement and with regard to our overdose death rate. But there are some comments that I want to make to the board about what we're dealing with here, kind of big picture. I've been in this business now for over 3 decades. When I was a young prosecutor in 1990, the undersheriff and I were in the Thurston County Narcotics Task Force back then. And of course, the drug of the day back then was cocaine. Heroin was on its way out, cocaine was coming in, and then we moved to crack cocaine. That eventually phased out in the methamphetamine, which phased out to prescription opioids, and now here we are again with through another heroin cycle, and now into fentanyl. All that experience, I've never seen anything like this. Never seen anything like this. With dealing with fentanyl. And I think this is something that we've really got to focus in on with some significant seriousness. There's really 2 powerful forces at work here in my mind. This is just me kind of talking from that experience that's driving this issue. One is on the demand side that was being talked about, and that is the substance use disorder and the prevalence that we're seeing out there now of that disease.
And that's, that's driving that. In the criminal justice system, we have, I think, spent a lot of time and energy working on that issue, right? Creating pathways for people out of criminal justice who are there because they are dealing with a substance use disorder, and trying to get them diverted out at the earliest best opportunity to get them into treatment and hopefully into recovery, and perhaps not see them back again, and perhaps even more so in a place where they can flourish. But the other side of the equation, the other powerful force at work here is just simply greed. It's just simply greed. And that's the side we haven't been talking a lot about, but I do think that has a place in the conversation. And because we've been hearing the prevalence of what's going on now with the efforts of the task force, and I thought it's worth mentioning that this is a multi-effort approach. We need to deal with the substance use disorder. We've got to, make sure that we have as many pathways as possible for people to get to recovery. But on the other side of it, the folks who are exploiting that to make money, we've got to take an aggressive enforcement effort, and both sides take resources. That's why I continue to have a deputy prosecutor to this day assigned to the task force, as you noticed. She continues to be focused on what we call drug trafficking, mid or upper level drug trafficking cases, the folks that are really doing this for profit, and really specializing that. But unfortunately now, also starting to focus on the controlled substance homicide, which is the person who sells for profit and the other person ends up dying as a result of the overdose. And it's challenging sometimes to sort those things out, right? And to try to figure out what path somebody belongs on. And that's the challenge of our work right now. But the message I just wanted to bring to kind of wrap this all up is just the fact that it's got to be a holistic approach, right? We got to be working both sides of this equation. That's my opinion, speaking from my experience. And I'd love to answer questions, but I think really you've heard the best information from the other experts today.
Okay. Any questions from board members to any of the group? Sheriff Sanders, did you have anything you wanted to say? Just give you the opportunity. Your team did a good job.
Yeah, I appreciate it. I appreciate it, Commissioner. Obviously, you guys heard more sad news today from Under Sheriff Pearsall that we've had a number of overdoses in our jail. This isn't anything new. I can remember way back in the day hearing about overdoses and things in the jail. What's different is the rate at which people are dying. Heroin overdoses. As a patrol deputy, I've Narcaned over 10 people who have overdosed on heroin, and they all survived. Kind of like what Dr. A was talking about earlier, confirming like we are having to Narcan these people 4 to 6 times just to get a pulse back to get them stable to go to the hospital. So drugs in our jail isn't new, but the lethality of the drug that's in our jail is. Lethality out on the streets is changing things drastically, and I can't help but feel holistically from the same approach as the prosecutor that you have a user end that needs help and they need assistance. And then you have a dealer end that needs to be hammered out of existence. Both those things are true at the same time. And I can't help but feel like this fentanyl crisis that we are really, lucky me, right? 2 months, 3 months in, we're having multiple significant overdoses in our jail. It's really putting a timetable on getting competent, legitimate health services out in the public for people to get a bed. One thing that Lieutenant Rudloff, which by the way, thank you, Lieutenant Rudloff, that was an excellent presentation. One of the things that they disclosed to me too is that a lot of times when they're dealing with people who want to work, who oftentimes have substance abuse issues, there will come a point in time where that person says, you know what, I really want to get help. I'm ready. And there's no bed available. There's no rehab available for them at that point in time. And what we all know, if any of us who know, someone who struggles with drug addiction, is oftentimes that window to get them help, very narrow, very narrow. You can have them signing the clipboard inside the clinic and they can back out right at the last minute. So it seems like we're on a timer now, but I appreciate everyone for presenting today. It's a lot of good information.
Okay, thanks, Sheriff. All right, so we're gonna close that up. Thank you to our guests and great, yeah, absolutely.
Just, these folks don't have it, but you do. It's the little spreadsheet there.
Mm-hmm.
So the case number, so each year we start off with 0001, so, and then ends in 01, so that last two digit is the month. So if you go down sequentially, you can see how many overdoses we had in January. If the number ends in 01, 02 is going to be February. So you can see the sequence as far as how close grouped these overdoses are. Some of these numbers are just 2 or 3 numbers apart. So sometimes we hit 5 in a week or 7 in a month. So it just depends. So if you look at that, you'll see the sequence of events.
Okay.
You guys have questions about that? How to read that on the case number?
22, then a number, and then -01 for
Yeah,
January.
the 01 would represent January and on down.
So the number in the middle is the way that you track all
That's
deaths
our
in the
case
county?
number, yep. So right now, I think, well, we had, so 3,000, I think we had 3,070 deaths last year just in Thurston County, and I think right now we're at 600. So, okay, thank you.
Okay, thank you. Yep.
I would just love from all of you who are experts, obviously this is expensive and it's costing resources, time, lives, all of the cost related to it. Where do you think we should be investing our work? And it's probably multifactorial, but where do you think the biggest bang for the buck would be?
That's going to be a discussion that's going to have several people at the table. Yeah, I can't answer that right now, but yeah, it's going to be some resources.
I think the prosecutor had said, the holistic nature, it does take, you have to have your enforcement side, you have to have your treatment side. Me personally, and I've been doing this 30 years as well, and about almost half of my career has been strictly narcotics, so I'm kind of an expert in the field. If I were to point to one thing right now that's really delaying things, it is the treatment aspect, the immediate treatment.
The microphones are the availability of beds in the county, or?
I'm sorry, I didn't hear.
Yeah, with the microphones, is it picking up, sorry.
So again, just the treatment aspect of what the sheriff was talking about, over the course of years in my narcotics work, we would have addicted individuals that were at their low point and ready for treatment and I need help. And, when I pointed them to the resource, it was like, well, it's now July and we'll have a bed free by October. That don't work. You just lost that person, period. So, I don't know what the funding involvement is on that. I know it's not cheap to get treatment, addiction centers and all that, but that in our society as a whole, that's where I see us lacking, is that immediate need to at least grab the ones that are ready when they're ready and get them to treatment.
And I guess I'll just say too, as a pediatrician, one thing we've really been trying to do is screen. So we're screening early, trying to catch them early, trying to get them treated early, and then addressing the mental health early so that we prevent the things that might lead to substance use disorder.
Absolutely. Every aspect of that is important. And again, this is why when our simple drug possession laws went away, I was really disappointed, not just on the aspect of me being a law enforcement officer, oh, now I can't arrest somebody for a simple possession. Every bit of the incentive you take away for that addicted individual to seek recovery, you've just lessened your chances. So that it definitely did not help us. And I can assure you, if you look at the numbers and what's going on and the overdoses, now that we're a full year, almost a year and a half past when they did that, where are we? We're double the figure, aren't we? It's not rocket science. So, thank you.
Thank you very much.
I'll just throw out on that point, the new law that is through the Senate and now potentially looking at being passed is trying, I think, trying to strike that type of a balance, keeping drug possession as a misdemeanor, but now there's some pretty stiff mandatory jail, even more severe than what there would have been. I'm looking at the prosecutor to see if I'm correct on this, but more mandatory jail than would have been, he would have been subject to if, at the previous pre-Blake felony level, if you fail to engage in a diversion and treatment option. So it's really trying to use that leverage that the sheriff's was talking about, lieutenant was talking about, and then, but keeping it at the misdemeanor level, which can help folks, move on with their lives later.
Right, that's Senate Bill 5536. It's in the House right now, and it does essentially that. It makes possession, returns possession to a gross misdemeanor, so it's not a felony. But it also has with it a diversion, an encouraged street level diversion. It requires counties to develop a diversion program from the district court and has some mandatory minimum jail times associated if somebody doesn't comply with that.
Does it have funding attached to it?
I assume there's a fiscal note, but to be honest with you, I haven't seen it, but I'm sure there's a fiscal note. It did go through the financial committee, so yes, there must be a fiscal note.
I want to say 51 million, looking, yeah.
Pretty sturdy. I mean,
May
because
not be enough, given all what they're really envisioning, but it's at least a good point to get started with.
the concern would be if you mandate someone pursuing help through a diversion program, but then you don't fund the counties to provide more
Yeah, that was
diversion
our first-
programs, then we're right, kind of in the same place.
Treatment program.
Yeah, no, it's
Right.
going to be a moving.
That's right.
Thank you. All right. Well, thanks to everybody on that. That took quite a bit of time, but it was important. We've been trying to pull this together for a number of months for this meeting. So I guess I'll ask our other presenters to keep things concise. Next up is item 5, permitting options for temporary food establishments. We went through the background last month. I was able to catch that on YouTube. And now we've got a little more specific business item. Sammy Berg from Public Health and Social Services. Take it away.
All right, thank you for your time, and as you mentioned, I'll do my best to keep this concise. And as a reminder, we were back here last month talking about the kind of the background of why we're here, talking about food vending and temporaries and how to maybe move forward with a better proposal. And so looking at and for the most part, we had, our proposal was to make this work through basically treating them like as a food truck. If you want to do routine food, then let's treat you like a routine food operation and use a variance to allow for not having the truck part of it, having the other components that go with it, kind of a deconstructed truck. But still strike that balance between allowing people the opportunity to have a stepping stone from idea to a fledgling business as they work to get funds or loans or capital or whatnot to then move into more of the mainstream food truck or actual brick and mortar business. One of the questions that was raised was looking to have kind of a comparison. And then, do you have the slides? Okay, there's a table that's blue and gray that kind of shows those kind of cost comparisons. So looking at that, just trying to understand that for the most part, what we're proposing as far as needed equipment and review and the variance cost, is basically on the ballpark of around $5,000 of a entry level for a new full-time business. And the main benefit to the vendors from that perspective is the previous pilot program that we were doing by state code limited them to 3 days a week. And what we're going with would then allow them to do 7 days a week with a lot more flexibility about how they operate, and is still orders of magnitude cheaper than having to buy a new truck or trailer, which is more in the ballpark of, $75,000 to $100,000, and certainly less expensive than getting into a real brick and mortar facility. So we see this as a way to do a balance between business opportunity and meet those needs while still protecting public health, protecting all the other consumers that are expecting us to keep them safe and keep their food buying options open, but again, stuff that they can do with confidence, and allow the vendor that opportunity to have a stepping stone into that market. And basically, the rest of the presentation kind of goes over in more detail, but for the most part, what we're looking for and asking for from you as the board would be, does proceeding this way meet your needs and your approval? We're looking to work with our director to develop policy that would allow us to have this process where we would review them like a mobile user variance to meet code requirements and move forward to allowing them to operate. The operators that are currently in the pilot program, we're looking to have a transition process, so we'll allow them to continue to operate as they improve their process and meet the new standards and give them time to do that. And then certainly be open for new folks that want to come in and have that new package together around, here's this pathway to get from where you want to be to what we need to get to you to approval. So that's the main ask, is essentially the nod. Are we headed in the right pathway? Are there other ideas, other things you'd like us to consider? And certainly, as this is a new endeavor, we would take a look at this. We would continue, as we do with pretty much everything we do, take feedback and make revisions and moderate things as we need to, as conditions change. Any questions? I know that was pretty quick, but I was trying to respect your all's time.
The only question I had is just, what is the inspection cycle? Is it just
So
routine?
we would inspect them the same, if we go through the more intensive review process up front and have better training and equipment, then the trade-off would be that we would treat them like a food truck and generally twice a year. And if there are problems, then we'll ramp that up. But generally about twice a year as part of that inspection process.
Board Member Mejia.
Thank you. So I'm seeing on the proposed variance, it's a 750 application fee, and then after that, it's a $610 permit. And I'm wondering, the 750 application fee, why is that so high?
With mobile units in particular, we've had to move to, our normal application fee is $250, which basically accounts for 1 hour of review time. On average, mobile units take about 3 hours, but also what we ran into is that we would do a number of plan review efforts, and the people would choose to not move forward with their proposal because they would hit various roadblocks, either with their business plan or with finding a good sales location or other many things that go into actually putting this into place. But we would do the review, they would not move towards completion, and we would not be able to recover the funds. So the 750 is charging them up front for the 3 hours. If there is unused funds, then that gets rolled over towards their permit costs. So from their perspective, they would have to pay the whole fee. We're asking just more upfront so that there's basically so that if they're unsuccessful in making it work as far as their proposal, then essentially the time and effort that we place towards it doesn't get lost, essentially. But if you have a solid business plan and you go through the process, then the fees that you're paying basically get rolled over towards that first year's permit. And then as you move forward, then it's just a renewal cost versus having to reapply every year like you would with a temporary.
So the 750 covers, if I'm understanding correct, it's covering that 1 hour to look over, this establishment plus the annual permit?
So it It presumes 3 hours of work, which is on average what it takes to do a mobile unit review between looking at the equipment, their process, their commissary, all the pieces that would make an effective mobile unit work. In general, it takes about 3 hours to go through that. So instead of charging upfront for the first hour and then billing for the next 2, we charge upfront for 3. And again, if any of that's unused, then we roll that towards the permit cost. And that was basically just kind of a cost recovery adjustment we had to do because several years ago when mobiles first were coming in pretty with a high intensity, there were a number of operators that were not well prepared to really move forward with their plans.
So I'm having a hard time understanding, right, when people like were applying for permits, right, and their business model didn't work out, and so they kind of went a different direction. Was the county then following up and was there an invoice sent or was there any kind of communication?
We would like they
for
would say, hey,
recovery?
I can't make this work. I'm going to just basically cancel the review. We would stop things at that time and say, hey, okay, we've spent an hour. Here's what the money you owe us. But essentially, if they weren't moving forward with the permit, we had very little leverage to actually collect those funds because there's no business, there's no leverage, there's no way for us really to effectively come back to them and say, you still owe us this money. We in the past have not gone through a collection process because in general, most of the people that are coming forward to us want to end up with a business. And so there's a continuing conversation to be had about paying the fees and making that work. With mobile units in particular, again, when they were coming on board as a new market trend, there were a lot of people that are coming into it that were unprepared, and we were spending a lot of time on that and not being able to recover those funds. And so we changed how we charge the fees for that initial interaction to get some of that up front and then allow the opportunity to roll that forward so that from the vendor's perspective, if they moved forward, they weren't out anything in particular. It was just a little more upfront versus having it happen 2 months later when they got through the review process.
So the annual permit with the variance, what I'm noticing here, it's basically like a $5,000 hit right off kind of the start with the equipment, with the 3,000 plus the application, the permit, the food safety training.
And from that perspective, they are wanting and seeking permission to operate a 7-day-a-week restaurant with a canopy and some very minimal equipment and be able to serve food to the public. Compared to the infrastructure needs of trying to get, again, a full truck or trailer or a brick and mortar. There is definitely some, a level of money that they need to invest into that initial process. But we also, on the other side, need to make sure and be comfortable that they know what they're doing. They are going to be able to produce safe food. We can't, it would be not prudent for us to say, well, go ahead and make food for a couple months and then we'll finish up these processes. Because the public still expects us to make sure once they're open, that they're safe. And we have confidence in that safety.
Vice Chair Williams.
And just to clarify, so these vendors, they'll be setting up every day?
They don't have to. Anyone that operates in the county, this will be a year-long, a permit to cover for an annual permit. And whether or not they choose to operate 1 day a week or 7 days a week, the main limitation in the way we did the pilot program last year was that state code said you could only do temporary food up to 3 days a week. And so people were able to do like the weekend, but they were not able to expand that. And this gives them that ability to then expand to more locations, more days a week, if that's what they wish to do. It'll be up to them to make that decision about how many days they want to operate.
And why 2 inspections a year? That seems very low.
In general, for restaurant inspections, for folks that are either medium or high risk, which are most restaurants, then it's 2 inspections a year. And this will be part of, as we work with the vendors under this program, we'll be paying more attention to them. We may find that we may need to do more. We'll start with 2 a year. We will likely be more intensive and do more follow-ups and drop-ins and things like that as we go through this year, and we kind of work with the vendors to kind of figure out where that balance should be.
Based on how many violations you see.
Right, and again, that feedback process, the gentleman with Carbon Pop, last year we were there pretty high frequency because we weren't sure about how that was going to go, and he proved to be someone that was able to be very consistent in his effort and his practices, and gave us some good confidence. And there were others that we found were clearly they did not have the skill sets to do that well. But a lot of that, we can make that assessment during the plan review process and the application review, and that's going to be matching up their plans, their menu, with a limited amount of equipment. And if that's a good match, then we should be good to go.
Okay, another question, yeah. Go.
Is there a timeline that these vendors will have before they move into or have to move into a more permanent place? Or
We don't, we're thinking a couple months. We do eventually, by the end of the year, want to get to everyone being under the same requirements. And so that'll be something we work with. Currently, we have 3 vendors that are active using this from the pilot program. And so we'll work with them to work on a time frame and kind of figure out what makes it mutually acceptable with that, but it'll be somewhere in that kind of range of several months to get them between the additional training and the additional equipment to move up into where we want them to be under this program. So we definitely are, definitely not looking to here's 30 days or here's 2 weeks or whatnot, but want to make that a realistic transition out of there, but we do still want to put some parameters around it so that it does happen and we get everyone to a pretty, level playing field.
And where are these locations going to be? Will there be on parking lots? How are parking lots going to be?
Generally, they're going to be on parking lots. What we've seen people want to do is basically sit in front of in the parking lot of a tap room kind of approach, where there you have a location that basically is serving the alcohol but don't have the ability or desire to make food. And so them sitting in their parking lots and providing food to their customers is the main model that we're seeing at this point. I'd presume it'd be something like that, not necessarily like on a sidewalk downtown. It'd be more kind of a parking lot approach. That's what we've seen.
Matchless springs to mind.
Yeah. So
Pardon me?
many of our local breweries, what they'll
Yes,
do.
Matchless, Northwest Beer
Heaven's
Works,
Mumby.
those kinds of locations.
Beer Works. So this, last year when this came up was because the breweries really brought this to our attention specifically because their businesses were being impacted by this quite a bit. Usually breweries in partnership with pop-ups will promote like this event, right? Carbon Pop, for example, they would be like, come, Carbon Pop will be at our location. And it would boost their business. And one of the big things we heard was, for when something like this doesn't happen or we're shutting down specific pop-ups that are just pop-ups, they dedicate themselves to this, we're really affecting their business negatively because they're not able to promote business, like their own business in other ways. And so we heard very strongly from a lot of our local breweries on this. And especially coming right off COVID where their business was low and then taking this hit was the reason why this pilot program really came to be. In part it was because of the pop-ups, but also pop-ups working in partnership with some of our very well-established businesses in the community. And so that was kind of just the whole situation.
And to piggyback on that, one of the ideas originally was the idea that, oh, well, if you're a tap room, then, work with a mobile food truck to park in there and provide some of that need. But what we've seen for the most part is most of the mobile operators would prefer to find a good sales location and just stay there 7 days a week and not necessarily float and provide kind of rotational service. And so this created a gap in the need, and this was one way to, some of the vendors thought they could fill it, but it hit a roadblock with some of our regulations. And so this is,
The
again,
vendors will be moving around.
and we don't necessarily have a problem with people moving around. That's easy to adjust to. It's can we approve you to operate wherever you are with the package that you're bringing, and then just know, oh, I'm going to be here and here and here and here, and then, oh, 6 months later, I'm going to be in these 3 locations. Great, let's just keep talking. We can make that work. You're running around with the same consistent package. You've got the same support, the same training, the same equipment. Okay, we can make that work. So this is our proposal is to make that work, and we feel basically with a better structure and better overall framework that's going to meet the vendors' needs, the public's needs, and the department's needs better than what we were piloting last year.
Saw Director Baines' hand.
Yeah, really quick. You might have spoken to this already, but one was, what feedback have you gotten from the vendors for this proposal? It would be good to let the board know. And then the other would be, do you have a comparison of the cost for this versus, say, a food truck startup? So you're looking at those fees and the requirements. I'm interested in like what that looks like compared to, say, a food truck. So those are mine.
Just I'll answer the second part first. So the food trucks would, except for that one-time variance cost, would be following all these, and like that $3,000 equipment cost would be wrapped into the $75,000 to $100,000 infrastructure needs around the truck or trailer. But the same type of application and fees and whatnot and permit costs are all the same for that model. And then we had reached out to Patrick Jensen, the owner of Carbon Pop, as well as a couple of other vendors that we had worked with this pilot project on, also with the Washington Hospitality Association and the Washington State Food Truck Association to try to get their feedback in this, because their members will be affected by this operation and this proposal. And everyone, the vendors that were active with this pilot project saw the value in this, and to them, the value of being able to go with the 7 days a week operation was seen as worth it to do these investments and the cost increase to get up and running under this proposal. We heard essentially nothing back from the Washington Hospitality Association or the Food Truck Association beyond to them it made sense as far as our proposal, but we heard nothing official either as a statement-wise from the organization or from any of their members that they did share this proposal with, at least in our area. And so, and like Janet had passed on that, again, we believe that this is a reasonable way to go and still keep that initial investment relatively low compared to any other business type, but still then balance out the public and the departmental needs. Is that?
Yeah, no, that's great.
Any other questions? Okay, there is a proposed action, and are there any concerns or final questions about the proposed motion, or somebody feel confident enough to make it?
Are you looking for a motion, or are you just
Do we
looking
need
for
this motion?
a straw poll?
Yeah, we have a proposed motion. So I think we're asking if, right?
Yeah, actually, I do apologize. I did not bring the.
I've got, it's in the agenda,
Is it
item
okay.
5A.
Move to approve the permitting options for temporary food establishments that propose to operate year-round at multiple venues without connection to a public event, and authorize staff to implement the final policy.
For a second.
I'll second.
Okay, we have a motion and a second to approve these permitting permitting options. Any discussion? Beyond? We've already gone through. No, okay. All in favor, say aye.
Aye.
Any opposed? Say nay. Motion carries.
Thank you for your time.
All right. Item 6A, noxious weed prescriptions. Michael Murphy, noxious weed specialist, welcome.
Hello there. Yeah, I'm Mike Murphy, a noxious weed specialist with Public Works, Noxious Weeds Department. And today I want to talk about 5 different plant species that we'd like to get approval for so we can treat these species in time. So first of all, let me tell you what a noxious weed prescription is. We write this prescription as soon as the plant is added to the state noxious weed list, or we find it in the county through surveys. And it's a species-specific control or eradication plan, and it incorporates integrated pest management. So it includes cultural, manual, biological, and chemical control methods that we may use to control the plant. It also provides a description of the plant, and then we use it as a reference for our staff when we're treating weeds on county properties. So to describe the 3 classes of noxious weeds, these are all regulated under RCW 1710 by the state. And there's 3 classes, with Class A being the highest priority because it's often a newcomer or it's not present at all. A good example of this would be giant hogweed that is often in the news in the summertime. But for example, giant hogweed in this county, there are no sites that have it present on it right now, but we have under 10 sites that we check every year, and that's how it goes for Class A weeds. As soon as we find that site, we are constantly in check to see if it returns. So they are our highest priority weeds to eradicate, and we have to eradicate them in accordance to state law. Class B makes up most of the noxious weed list, and control of that is dependent on county and distribution. An example of a Class B weed would be Scotch broom. Here on the western side of the state, it's so prevalent, there is no chance of getting it under control. So it's not regulated in any of the counties west of the Cascades. But when you go to the eastern side of the state, it's much less prevalent, and it is on their noxious weed list. And so that's why it is a Class B, under the state weed list. Class C weeds are widespread and eradication is likely not possible, but the county weed board can require control if it poses a threat to agriculture or natural resources. An example of this would be yellow flag iris that we treat on county properties because our county weed board has selected it for control. So let me get into the specific weed species that we are looking to get prescriptions approved for. First one is egg leaf spurge. It's a Class A noxious weed. It's toxic to humans and livestock, and it can spread from its original site by ejecting seeds up to 16 feet, and those seeds remain viable for up to 8 years. And then it can infest hayfields and contaminate crops. The good news about egg leaf spurge is that only a single plant was found on a parcel on the downtown East Olympia, and it was controlled manually. But we have been returning to that site. Last year, there were some seedlings, and we'll return to that site within the next month, actually, because we do time our plant inspections based on blooming and things like that. So this, I do expect this site to be eradicated, but we'll always keep following up on it and the neighboring area to make sure that it hasn't spread anywhere. But this image that's on this page here, this is Central California where this weed is really prevalent. And a site like this that is infesting a huge area, there would be no way to possibly control this through manual control. And that's when we would have to use an herbicide for control. Our next weed is garlic mustard. This is another Class A noxious weed. It showed up in 2021, also on the east side of Olympia. A pretty large site, less than 1/4 of an acre, but it was on 2 private property parcels and also on the city of Olympia right-of-way. The problem with garlic mustard is what you can see in this image here. It takes over the ground cover. It can also outcompete all of its neighboring and native vegetation because of allelopathy, which is just producing chemicals in its roots that will kill other neighboring vegetation. We did get a quick response from the property owners of those 2 parcels, and we assisted them. And so what this site required was an initial removal manually of all of these large plants, and then a follow-through with chemical control to get rid of all of the seedlings. And the next image just shows a before and after image, and just showing how the manual control and the chemical control. And this site is definitely looking much better over the next 2 years, and hopefully it's very close to the interstate. It's one of those we definitely don't want it to move out because it could really spread widely. Our next weed is a group of thistles. We already have a prescription for slender flower thistle, but we want to incorporate Italian and Turkish thistles into this because they're very similar. In fact, that they'd be really difficult to distinguish at a glance the differences between the species, but they all have the same characteristics, and so the control of these thistles would be the same. And they're a lot different than the common thistles, the Canadian and bull thistles that we have, in that instead of a rhizome mat, a connection of roots, they have a taproot. So individual plants could be manually controlled and pulled out. And we do have 6 sites that we've been monitoring for many years, 3 of them being on I-5. The DOT maintains those and keeps them from coming back, or just checks the sites each year to make sure they haven't come back. And then there's 3 in the Yelm area that are on farms, and the landowners are well aware of it, and we just give them a notification each year and let them know about it and make sure that they're keeping it under control. So this is another one, of course, in a large infestation, you would have to use chemical control on this also. Our next species is hanging sedge. So this is a Class B noxious weed, eradication is not required, but it has been selected for control by the state in Thurston County. The problem with hanging sedge is that, like all of the other weeds, can outcompete native vegetation, especially if it moves into a riparian system. And you can see this big hanging seed head on this plant. This is a really large sedge plant that right now we're finding it in people's yards. It's all been found on the west side so far, near downtown and around Evergreen. And we do have one on the county right away that is near Evergreen, actually. But property owners, even when we notify them of this, they are aware that it's spreading in their yard, and a lot of them maintain this by making sure they cut these seed heads off before they have a chance to germinate, or they're keeping it mowed down so it doesn't have a chance to grow. And so at this point, we just hope to keep it under control, and if it started to move to a creek or a river system, we would have to do an initial herbicide treatment to keep it from becoming out of hand. The next species is lesser celandine, another Class B noxious weed that has just made an appearance in the county last year. This is, if you're familiar with buttercups, you know how invasive they can be. Once a buttercup patch is really difficult to get rid of, you can try cultural control, which would be something like putting a cardboard mat on it. Or you can try to dig it out, but there's so many parts underground with the buttercup type of family, and the same thing with lesser celandine, that initially we did try some manual control on this on private property to assist landowners, and to get all of the little tuber parts and bulbils, they're called, out of the ground, we removed 400 pounds of soil from a small area. And so in that case, we risk transferring we took it to the work, bagged up, but you do have a great risk of moving it from that site. And that's when you see an image like this is from Whatcom County. I think this is one of the ones that, there are other weeds in the past that we've lost our grip on many years ago, like yellow archangel or shiny geranium. Once this starts getting dumped into the woods or anything like that, it would take over so far that we probably wouldn't be able to control it. But the good news at this point is it's just at these 11 sites. Once again, mostly in the downtown area, in residential areas. And when it's pointed out to homeowners, they realize it's spreading in their yard, and they usually respond quickly and treat it. And so just one more image here showing, on the left, this is the kind of infestations we're seeing now. And right now is the actual time you'll see it. It does pop up. One of the first flowers you would see right now pops up in February or early March, and then the plant just kind of disappears, but as soon as it warms up. But what we want to prevent is an infestation like on the right. So to summarize, going through the species again, so for Class A, egg leaf spurge, garlic mustard, and slenderflower. And these are the specific chemicals that we would use to control them. Imazapyr for egg leaf spurge, triclopyr for garlic mustard, and either triclopyr or aminopyrrolid for the thistles. For Class B, hanging sedge for imazapyr, and for lesser celandine, glyphosate and triclopyr. Our goal in the county is to not use glyphosate as a higher hazard chemical. But the literature does recommend, and in other counties such as Whatcom County, and according to the State Noxious Weed Control Board, glyphosate is the main recommended chemical, but we are going to use triclopyr when it appears on county property. And I hope I made that clear. None of these weeds have appeared on county property yet, except the one hanging sedge site. So if we find out after it appears on county property that triclopyr doesn't work, we need to keep glyphosate on the prescription to be able to use it as little as possible, but to prevent one of the large infestations. And just in response to the cost of doing this, at this point, manual control is, it's being done really quick because the weeds are in such low numbers. It's just to check all of these sites is just a very light part of our workload of inspections. But when an infestation starts to become big, it definitely makes sense to use an herbicide rather than the many hours that it would take to manually control a large infestation. And with that, I will turn it over to Patrick to discuss some of the specific integrated pest management.
So I'm Patrick Soderberg. I'm the Integrated Pest Program Coordinator. So what I do is I work with the departments when they develop their prescriptions, and then we have a meeting with the Pest and Vegetation Management Advisory Committee, and they go through the entire prescription with the department. They go through the timing, monitoring, the injury level, because these are noxious weeds that are listed. The injury level is just the presence of these weeds in our county. And then they go through the active ingredients of the products that are proposed to use, and then me as the environmental health reviewer of those, I go through all of the risk and the hazards that have been identified in the policy to denote whether it's a high hazard, medium hazard, or low hazard pesticide that they're proposing to use. So the advisory committee has worked with them. It sounds like the mic's still on. So they have reviewed these prescriptions. They've evaluated them. The department has made some refinements in them and clarified some of when the herbicides are going to be used. As Michael stated, most of these are at infestation levels that can be controlled manually with just a few hours of manual labor. Once they get to a stage in which it will take, several hours to a day to manually control, that's when they would switch over to an herbicide to make sure that they're effective in the complete control and eradication of these weeds. The advisory committee recommends adopting all 5 of these prescriptions. And so that's what their recommendation is to you at this time. The criteria in which the board reviews these and makes their decision is, number 1, the pest and vegetation problem has been assessed and the action level has been met. And I'm just going to read these, but then the next slide will actually have information to answer those questions. The use of pesticides is a necessary element of integrated pest and vegetation management prescription, and the risk to public health, groundwater, and the environment is determined to be minimal. So the next slide in blue is kind of the answers to those questions, or at least the evaluation that you guys can make your determination on. So all of these are listed noxious weeds that require, the law requires the county to control. So that's, the problem has been assessed and the action level is met. Use of pesticides are necessary. All of these are being controlled manually until the infestation gets large enough to where they need to have a prescription in place before they can use chemical controls. So since these are present, or most of them are present in our county right now, it's time to get something in the books that allows them to react to a larger infestation than what they've found so far. The 4 chemicals or active ingredients that are being proposed to use, aminopyrrolid and imazapyr, are very low in toxicity to both animals and non-target organisms. They get used at very low concentrations, and they're extremely effective for the plants in which we're utilizing them on. Triclopyr, I'm sorry, they're both moderate hazard, not for their toxicity, but because they're both persistent, and that means their half-life is greater than 60 days. They're both mobile, so they don't bind well to soil, and so when it rains, they have the potential to move off the site of application. We don't broadcast applicate any of our weeds, we spot spray them. So we literally have staff go in and spray each plant individually as opposed to using like a boom truck or something that would spray a general area. So spot spraying definitely minimizes the amount that you put on and the potential for runoff because you're actually just putting it onto the plant itself. Triclopyr is also a moderate hazard, but it's more, the hazard is more associated with non-target organisms like birds and small insects. But that's typically when you broadcast applicate over a large portion where basically a bird will only be able to eat from a contaminated area as opposed to when you spot spray, they would have to target they would only have to eat from that one plant. So that reduces the risk to non-target organisms because we're not spraying it across all the vegetation in the area. Glyphosate is a high hazard for, it's listed as a probable human carcinogen from one of the authoritative sources that we utilize, which is the International Agency for, it's IARC, for the Research of Cancer. And so they have it a probable human carcinogen. The EPA has it as not likely to be a human carcinogen, so you have 2 authoritative sources that are not in agreement. The US EPA looks at it as the application rate that is on the label, and that's why they don't perceive it as being a carcinogen, where IARC as an agency looks at its potential. And so its potential, they consider it a probable human carcinogen. Right now, our only proposed use for these is in a test plot, and if triclopyr is successful, then we won't utilize glyphosate. So those would be the points in which you would make your decision on whether you would adopt these new prescriptions or not. Do you have any questions on any of that?
Yep, we'll go down the line. Go ahead.
I was going to move to approve the noxious weed prescription for egg leaf spurge, garlic mustard, hanging sedge, lesser celandine, and slender flower, Italian and Turkish thistles.
We can do if there's a second, then we can have discussion on that motion. Is there a second to that motion?
Well, second.
Okay, so a motion and second to approve the 5 prescriptions. Discussion, Dr. Harvey? I couldn't see who was Vice Chair Williams.
I had a question. Is there a large infestation right now in the county for any of these?
No.
I think it was, lesser celandine is about 11 sites, and there's all small and residential properties right now. None are on county property.
Then I had another question. Spraying individually, would those not be able to be removed manually?
Right now, they are being removed manually. So right now, all of these weeds are being removed manually because they're so small. What we're doing is trying to get a prescription in place for if they go out and do their surveys this year and one of those or new site is very large, then they wouldn't be able to control it manually. This would give them the opportunity to use pesticides or herbicides for that.
So we're crossing our fingers, we won't need to use any of these, but we're
Correct.
authorizing that use if it turns out to be warranted based on the inspections.
Correct.
Okay.
I do have a question. You mentioned a couple of times that glyphosate, did I say that right, would be a second tier treatment if the
Well, right now, what
triclopyr doesn't work?
we're hoping to do is, if there's a site that's large enough, we would do two different test plots, one with triclopyr and one because glyphosate is, all the literatures, we know that glyphosate works. What we're trying to do is utilize a lesser hazardous one preferentially, but we don't know if it works. So we have some documentation that it's likely to work, but we need to make sure it works, so we want to do test plots and compare the two and use the lesser one if it creates the efficacy that we need.
So my question was, is that actually spelled out in writing somewhere, that that's the route you'll take?
Is it written into the prescription that way?
Includes both chemicals.
So it's at the discretion of your department?
Is there a policy, like, separate from these prescriptions that show that you're gonna go in the order of manual and then less?
Well, that's typically how, if there's more than one, and they typically, so that we don't have to come every year. So let's say we only put triclopyr in now, and then we found out through the course of the year it didn't work, then those sites would get larger, and then we'd have to come to you again with a new prescription to include glyphosate. So what we're proposing to do is put them both in, and if the lesser one works, that's where we will stay. So I don't know if you want it to be amended to specifically say that?
I have a follow-up question. In the last several years, how often did you have to use glyphosate?
Right now, I don't think we've used it at all on this particular weed, have we?
Oh, no, on these weeds, no.
In the county?
Michael, maybe come up to them.
On
Are you
county, none of these are on county properties yet. So are you asking for our entire noxious weed list? Or, I mean, what?
So how often in the last several years have you, in this county, have you had to use glyphosate? Yeah, on the, on our grounds.
Okay.
So we have many prescriptions. I want to say we probably have over 20 or 25 specific noxious weed prescriptions, and some of them do have glyphosate in it. I would have to get the annual report in order to answer your question, because we have several sites that we specifically use glyphosate for very specific reasons. So I can't tell you how many sites or how much we've used in the last calendar year at this time.
Follow-up. And so for these specific weeds, in the last couple of years, how often did you have to use this specific prescription for those
Zero.
weeds?
These have all been controlled manually so far.
Do you guys anticipate these weeds needing this prescription specifically?
Yes, definitely. For lesser celandine, for example, that is the only one. Once lesser celandine, for example, makes it onto county property, we tried manual control on a private property, and that's where I said you have to remove so much soil that there's not a chance of doing it, and then you risk moving it off-site. So I think that would be the one that we would use, triclopyr, as soon as it was on county property, rather than trying to dig it up, to clarify. But otherwise, for these species, we have not used it. No.
It sounds like maybe there was a suggestion that we could, I'm trying to get to the page I'm looking for. We could be explicit about the fact that glyphosate or lesser celandine would be used only in the instance that triclopyr is ineffective.
Yep, if it moves on to county property, turns out triclopyr doesn't work. I mean, it's definitely, what has been recommended by the state noxious weed control board's written findings, and then from like conversations with Whatcom County where they have it. But we're hoping triclopier does work, but I mean, hopefully it stays on private property and doesn't move to county property at the best, would be the best result. But yes, hopefully we don't have to use glyphosate. If so, as little as possible if it did move on to the county.
So if it moves on to county property, we're responsible to dial it up, and that's so. But
Yep.
if it's on private property,
Intervene in it.
do we
Yes.
work with them on what they can do?
Yeah, well, county, they can do whatever is legal. In the case of Lesser Celandine, when we notify them, I would think, I bet all of them probably did use glyphosate because that's what they had on hand. And there are times when we do provide assistance for people, depending on their situation, that we will go onto their private property and get their permission and everything, get a whole permission form and treat it for them.
But I mean, we have an incentive to want to, one way or another, to have it not spread.
Yes, for sure. That's the biggest part of our job is over 4,000 people, will combine in county and private properties is just to try to time our inspections with weeds before they go to seed and get that homeowner or landowner to treat it as soon as possible to not allow it to go to seed another year.
Okay, we do have a motion and a second. Is there any further discussion on this motion? Okay, I'll call for the vote. All in favor, say aye.
Aye.
Any opposed?
Nay.
Nay, okay. So I believe that's, and there were no abstentions? Okay, so that motion passes. Board Member Edwards, I didn't get your vote.
Can you hear me now?
Yep, absolutely.
Yes, I'm voting with the majority, sir.
Okay, very good. Just so we have a record, that makes it 6-1. That's Chair Williams. All right. Thank you, Michael.
Okay, thank you.
That's what you need. Last item, kind of department item could be very short, but it's called Fiscal Subcommittee. I don't know if, David, you wanted me to give an introduction, or you want to give an introduction?
I was going to say, this is all you, Chair.
Okay. So, our resolution establishing this board provides for the ability to have subcommittees. And the one that we don't want to overwhelm ourselves or any of you, but the one that we've talked about needing is budget recommendations, fiscal recommendations. This relates to kind of how we had to do the foundational public health recommendations very quickly, and we want to start that process a little earlier with some recommendations coming from a subcommittee. So we thought this would be a good place to start, and then we can see how the subcommittee works. If we need other ones, we can, form other ones. But this one we know we need, so let's see how it will go. So the thought here is simply to I'm going to let Director kind of tell us what the subcommittee members might be addressing besides foundational public health, and then if there are volunteers, we can start there. If folks are still not sure about that, might want to think about it, then we'll just plant the seed tonight and we'll revisit it at the next meeting and try to, because once we have, you'll be supported by staff, and once we have our members, we'll want to work out a schedule and kind of, that'll be up to the subcommittee to work on a timeline that's most convenient for everybody. But David, why don't you kind of pick that baton and give us some more detail?
And I'll keep this pretty short. I think the genesis of this was foundational public health, as you guys remember. But when talking with the chair and talking to county manager, we realized we have an opportunity to really make sure we educate the board at a kind of a broader level about the department's budget. We have probably one of the more complex budgets in the county because of the nature of the funds that come in. And I realized in the discussion that you all had earlier this year that it's hard to see the decision-making we're doing in a vacuum. So when you're looking at one item from FPHS, you're going, wait, how can we fund this somewhere else? We might have other ways to do that, right? So I think it was important for me that as we prepare for not just FPHS, but for our biennium budget period, it would be helpful for you all to kind of understand kind of our key programs, key funding sources, And then as we get closer to the process, there are gonna be things where I think it'll be really useful to have your input or recommendations on decision-making, we need to go this direction or that direction. My intention for this isn't for this to be something where you have to spend, every week of your time discussing fiscal processes with us. But I do think it's an opportunity to meet maybe more frequently with us than just once a month to kind of get a little bit more in-depth conversations. I know that, Robin has offered one of her staff to attend some of these meetings. We'll have our fiscal staff attend as well, so you won't be on your own trying to make sense of spreadsheets. Again, I think my hope will be to have an educational process, for at least for those first few meetings. And as we get closer to times for recommendations or ideas, you'll be more grounded on what we're talking about and what we're doing. So that's my perspective anyway of this subcommittee.
Any questions about that, or?
I'm ready for a motion. Or I'm ready to make a motion, sir.
What kind of motion?
Oh, it's the
Oh, we have to,
move
that's right, I forgot. We're gonna create it no matter what, or we're gonna hopefully, potentially create it, even if this month we don't have any names attached to it yet. So, go ahead, I'm ready for that motion.
I would move to create the Board of Health Fiscal Subcommittee.
Okay, motion is second to create this subcommittee. Any other discussion about that motion? Hearing none, all in favor say aye.
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 Okay, any opposed? No, that motion passes unanimously. Now, is there anybody who believes they're the right person to step up and serve at this juncture, or take it up again next year?
Depends on how much time.
I'd be willing to serve, but it would depend a lot on the schedule and the time commitment.
Same.
It's up to that's not defined by us, to be clear. You would define your frequency of your meetings and your cadence, like that's totally up to you all.
And the conversation to discuss that timeline and that kind of commitment, what do you propose? That would be like
I think my suggestion would be you figure out who the members are, and then from there, we'd figure out sort of what that looks like. I don't know the appropriate kind of call to action county manager on how to do that.
My suggestion will be to get 3 volunteers, hopefully know the sitting commissioners. I think it will be a good opportunity for their board members to participate in this process, learn the process, and understand the complex budget. And as a result, the subcommittee will provide recommendations to the full Board of Health that eventually will go to the Board of County Commissioners. If there's 3 volunteers this evening, we'll work with the volunteers of the Board of Health to determine what will be the right schedule that works with all of you, and making sure we have the right frequency that doesn't necessarily affect your day jobs in a way. But that's really the intent of the subcommittee, is to bring you on board and a little more in detail related to the budget decisions the board may be considering in the fall.
Is that likely in your mind to look like a Zoom meeting or an email chain or?
Yeah, either way, whatever is, we can have a Zoom meeting, we can have in person, whatever it works for the subcommittee members. We can provide all the documentation via email, whatever's more convenient. Staff is here to support that effort.
Okay. Would the 3 to my right be willing to engage in that conversation and see where
I
it
want time to
goes?
think about it.
Okay. Then we'll take this up again next month then, and see if we can nail down 3.
The members can think about this and send some, your willingness to serve to the
Jamie?
clerk of the board.
Yeah, because if you decide, you know what, I've thought about it, and I don't want to do that, then it'd be good for us to know that,
Well, then-
and we can
So we can at least begin the
explore
process.
who that second,
So
third
that-
member might be. Okay.
Or the chair can just assign that to the.
Told. Yeah.
So I will just say that the official opening of budget season in Thurston County, we've already started building our budgets, but officially, the call to budget is right at the end of June, and offices and departments have to submit their budgets the first Monday of August. So there's surprisingly not a lot of time between now and the time Department of Health will submit their budget for Board of County Commissioners consideration. And we're really hoping that this board will make recommendations on those budget requests. So we want to start working with you as soon as possible.
Thank you.
Okay, fair enough. Thank you. All right, let's go to our health officer's report. Dr. Abdul, come on up to the podium.
Good evening, Board of Health. I will do my best to keep this brief. So I'll start with our COVID-19 update. So we're at 50.2 cases per 100,000 over the past 7 days, and 108.2 cases per 100,000 over the past 14 days per the Washington State Department of Health COVID-19 dashboard. Looking at the CDC dashboard, for hospitalizations for the week ending on March 11th. We're at 3.2 hospitalizations per 100,000 over the preceding 7 days, with 4.2% of our adult beds occupied by COVID-positive patients and 2.2% of our ICU beds occupied by COVID-positive patients. We continue to have a low community level for COVID-19, which is good. And that's kind of the guidance for the general public, and that's that composite score of transmission and healthcare system burden from COVID-19. We have seen an uptick in transmission over the last 2 days. So there are two different scales, and this is where it gets a little confusing. So the community level, which is really what the general public should be following, is low. The transmission level, which is what the Washington State Department of Health bases some of their healthcare provider guidance, which just looks at straight transmission. We've edged up into just looking at that metric, we've edged up into the CDC high transmission range. That just means that there are some additional precautions that healthcare providers should be taking until we've gone down to a lower transmission range for 14 days. This is not the first time that this has happened recently, and so one of the things that we've done as a department is we're alerting healthcare providers about this shift into this higher transmission range. We alert healthcare providers once we get below that range, and we alert healthcare providers once those 14 days have passed, just to make sure that everyone's up to date on kind of what the appropriate COVID mitigation guidance is. We are looking, so the Washington State Department of Health has announced that the Secretary of Health's masking order, which currently covers correctional settings, and once again, we're going to switch back to the community level, which requires masking for community levels for medium and high. We're currently low on that, as well as masking requirements for healthcare and long-term care settings. That order is going to be sundowning on April 3rd. And so while that order is going to be ending, the Washington State Department, we anticipate that there will still be a recommendation to mask, but it will not be an order from the Secretary of Health. The guidance for healthcare providers is currently undergoing review for COVID-19, and as that guidance gets reviewed and updated, then we review it once it's released to determine what's appropriate for Thurston, and we'll be sharing that information with providers in the community as that comes to us. I wanted to talk a little bit about variants. So looking at the CDC Nowcast for Region 10, which includes Washington State, about 82.8% of sequenced COVID-19 specimens are the XBB.1.5 variant. It's a highly transmissible variant, but we're not seeing a safety signal in terms of hospitalizations or deaths, and we continue to monitor. We are looking at, we're looking forward towards the end of the national public health emergency on May 11th. There are a number of changes that are coming with that. So just wanting to focus a little bit on some of the changes that will affect our community. So the Say Yes COVID test program run by the Washington State Department of Health, which allows folks to order COVID tests at no cost, will be sundowning on May 11th. Also ending is the requirement for health insurance providers, so Medicaid, Medicare, private insurance, to provide 8 tests per person per month. That will also be ending on May 11th. The Washington State Department of Health is looking at what capacity looks like in terms of continuing to provide tests, for high-risk populations. So we're anticipating that schools will have access to tests through the end of the year, and there's still conversations about what that might look like going forward. And just wanted to kind of round out the report with a little bit about our other viral respiratory illnesses. So the good news is in Washington State, we're at minimal transmission for influenza. And we only saw influenza A in the last reported week, which is week 9. And this definitely reflects what we're seeing in Thurston County. So across the state, we're looking at about 1.4% of visits to qualifying facilities being due to influenza-like illness. And that's below the average of 1.8, I believe, percent. So we're doing pretty well there, and RSV is similarly down. So we've got a lot of changes coming up, but overall, the burden of viral respiratory illness is significantly diminished. And with that, I'm open to any questions anyone may ask. Thank you so much.
Nope, looks like we're good.
Thanks.
I just have one comment. Thank you for the communications. It's very helpful.
Thank you.
Director, anything you want to add?
Appreciate folks' patience today. The only thing I was going to add is that we have hired a new assistant director for public health. Her name is Jen Freehite. She is starting on March 27th. So she's coming to us from Wisconsin. She'll be moving here physically in early April, and actually I believe her first full day in the office will be our board meeting in April. So it will be a good chance to introduce her to the Board of Health.
Trial by fire.
I'll make her present.
It'll be a long day.
One last item, the state is sponsoring trainings for Board of Health members, especially new Board of Health members. It's not mandatory, but it's available. Expenses are paid by the State Association of Counties. So for us, it's going to be May 2nd, 3rd, and 4th, although the 2nd is really, there's like a film in the evening, so it's like really the substantive stuff starts on the 3rd. So if you were available the 2nd through the 4th, or even the 3rd and 4th, it'd be great. I did it, and I think Director and I are going to be attending this year as well. It's in, I forget the name of it. It's someplace near the Canadian border.
Blaine. But it's the Semahu Resort.
Oh, it's lovely.
A good spot, if Peg's according to his good picture.
I've been there. Yes, sign me up.
Let Jamie know if you have interest, and we can make all the arrangements.
Beautiful setting, for sure.
It was really good the first time about background on boards of health and all the statutory stuff. And I mean, you probably got some of this, but for me, I like to hear it over and over because it's a lot of detail. Robin was there last time, and so I think we appreciate anyone who is available to avail themselves of that opportunity.
Will somebody send information out about that?
I did. I forwarded the emails to all of you.
Okay, thank you.
Okay, anything else for the good order before we? Thanks, everybody, for being here. Great meeting. We're adjourned.